Protein kinases are these fascinating enzymes that change the structure and function of other proteins, and they cause those proteins to have all sorts of biological effects. They're involved in every physiological function. They have hundreds of different substrates, and they're overactivated in disease states. And so the whole idea is, can you modulate that overactivity and alleviate the disease?
So Paul has been working on an approach of targeting or modifying activity of kinases called ERK1 and ERK2, and presented that work, and you had been doing that for a few years, and presented that work at a seminar series that we have called the Inflammation Research Group meeting. And I have been interested in lung injury for a long time, and inflammation and what causes it. And there's a similar molecule to ERK called P38, sort of same family. And after the seminar where Paul presented his work on ERK, I said, I think we may have another target we want to look at. And that's where we got the idea to target P38 in the same way. And so that all started in about 2014, I think. And by 2016, with the help of Alex Mackerel and the Center for Computer-Aided Drug Design, we had our first compound, which was one that was commercially available. Small compound, wasn't used for anything, but it seemed to prevent lung injury in mice, and that's what got us started.
And inflammatory responses that are detrimental. And so the idea is, can you turn that down? Some inflammation is good, but you can't. Too much is bad. So we're trying to dial it back so that we can alleviate the health issues associated with diseases like ARDS.
Right now, we're looking at it in acute respiratory distress syndrome, which is a problem where you have injury to both lungs, requiring a mechanical ventilator often, and has a fairly high mortality. There aren't any real pharmacologic agents that work yet. There's only a couple of things we know that help, so it's really a disease in the need of help, pharmacologic agents. We're also looking at traumatic brain injury. More chronically, it may be playing a role in muscular dystrophy, and we're also possibly in rheumatoid arthritis, chronic inflammatory disorders as well, rheumatoid arthritis, inflammatory bowel disease. These are all sort of on the list of things we want to look at. And because it's such a central player that P38 is, it's involved in all these diseases.